The story of how we treat depression, well, it's probably not what you think. It's not some straight line of scientific genius. Instead, it's this winding road, full of lucky breaks, total surprises, and a big central idea that, well, it turned out to be a lot more complicated than anyone ever guessed.
So let's just start with this one question. What if the single biggest breakthrough we ever had in treating depression was a complete and utter accident? Because that's exactly where our story kicks off. Not in a fancy psychiatric lab, but somewhere totally unexpected. All right, let's wind the clock back. Picture it. It's the 1950s. At this point, if you were dealing with depression, your main option was psychotherapy. Talk therapy. The whole idea of a chemical fix, a pill for depression, it just wasn't really on the radar for most doctors.
Then, two completely unrelated things happen. First, in 1952, doctors are running trials for a tuberculosis drug called ipronaizid, and they notice this really strange side effect. Their patients are suddenly in a much better mood. Then, just 4 years later, a doctor in Switzerland sees a similar thing happen with a totally different drug, imipramine, which was supposed to be an allergy medication. I mean, let's be clear, neither of these drugs was ever designed for depression, yet somehow they both seem to be working against it.
Now, you gotta understand, this flew in the face of everything the medical community thought at the time. The general consensus was that depression was a problem of the mind, something you had to work through and untangle by talking. So these accidental discoveries, they were a huge shock. They pointed to a biological cause that almost no one had been seriously considering.
And these accidents, well, they basically kicked off a revolution. All of a sudden, scientists had this incredible puzzle in their hands. Two very different drugs, made for two different diseases, were both having the exact same surprising effect on people's mood. The race was on to figure out why.
And the answer, it turned out, was all in our brain chemistry. Researchers figured out that both of these drugs, different as they were messing with the same class of brain chemicals, a group of neurotransmitters called monoamines. You can kind of think of these as the brain's little text messengers, zipping signals from one brain cell to the next. And right there, a simple, incredibly powerful idea was born. The logic just seems so perfect. If a drug that boosts these brain messengers makes depression better, then depression must be caused by a lack of them. And that was the birth of the chemical imbalance theory. It was easy to understand, it felt right, and for the very first time, it gave people a clear, biological reason for this incredibly complex illness. But here's the thing. These first drugs were, well, they were far from perfect. They were really blunt instruments, kind of whacking several different monoamines all at once. And because those chemical messengers do all sorts of different jobs all over the brain, that lack of focus led to a whole host of side effects. We're talking everything from headaches and grogginess to even problems with memory and just thinking clearly.
So that brings us to the next chapter in our story, the quest to turn that blunt instrument into a precision tool. Scientists knew they were onto something huge, but they really needed a cleaner, more targeted drug, one that came without all the baggage. They were basically hunting for a silver bullet. And as they studied these early drugs through the 1970s, a pattern started to emerge. It turned out the drugs that seemed to work the best all had one major thing in common. They had a really strong effect on one specific monoamine called serotonin. This was a massive breakthrough. Suddenly, the target wasn't so broad anymore. Once they'd zeroed in on serotonin as the key player, the path forward became crystal clear. Step 1, isolate your target. Step 2, engineer a molecule that would only affect serotonin by blocking the brain cells from sucking it back up. And step 3, in 1988, all that research paid off with the launch of fluoxetine, which you almost certainly know by its famous brand name, Prozac. Prozac was the first of a whole new class of drugs, the SSRIs, that stands for Selective Serotonin Reuptake Inhibitors. And the name honestly tells you everything. They are selective, meaning they only go after serotonin, and they inhibit its reuptake, or its reabsorption. The end result? More serotonin is left hanging around in the synapse, that tiny little gap between brain cells, where it can keep sending its signal. This was just a monumental leap forward. Think of it this way. If the old drugs were like a shotgun blast, hitting a bunch of different targets all at once, SSRIs were like a sniper rifle, hitting just one, serotonin. And that incredible selectivity meant they worked for a lot of people, but with way fewer of those tough side effects that came with the older meds. And the impacts? Oh, it was absolutely massive. Prozac wasn't just another pill. It became a cultural phenomenon. I mean, just look at this chart. The number of people getting treatment for depression just skyrocketed in the 90s. It was the first time there was a widely available treatment that people felt had manageable side effects. And this had this incredibly profound effect on society. By framing depression as a biological problem, a simple chemical imbalance, it did so much to reduce the stigma and the blame that had surrounded mental illness for centuries. Suddenly, it wasn't seen as some kind of character flaw. It was a medical condition, and that empowered so many more people to actually go and get help. So, you might think that's the end of the story. A happy accident leads to a powerful theory, which leads to a world-changing drug, a nice, neat package. But of course, science is almost never that simple. As more and more people started taking these drugs, scientists started noticing some puzzling things. Holes in that simple chemical imbalance theory. So here's the first big nagging question. We know for a fact that SSRIs change the serotonin levels in your brain within hours of taking them. And yet, most patients don't actually start to feel better for several weeks. Now, if the problem is simply low serotonin, shouldn't the fix be almost instant? This time lag just didn't make sense, and it was a huge crack in the theory. And it didn't stop there. More and more questions started piling up. For one thing, SSRIs don't work for everybody, and some people actually get better on drugs that target totally different brain chemicals. Then there's the fact that for so many people, the best treatment isn't just a pill, it's the pill plus talk therapy. That simple, neat story was really starting to fall apart. Okay, to really get at the logical flaw here, let's use a quick analogy. Imagine you're out hiking and you get a nasty, itchy rash from some poison ivy. So you go to the pharmacy, you get a steroid cream, and it works. The rash clears up. But here's the question. Would you then conclude that the cause of your rash was a steroid deficiency? Of course not, right? The cause was the poison ivy. And that right there is the core issue. Just because a treatment works, it doesn't automatically mean it's fixing the root cause of the problem. The steroid cream treats the inflammation, the symptom, but it does nothing about the poison ivy itself. And in the same way, it's possible that antidepressants are treating a symptom of depression, not its fundamental cause. So, all of this brings us to where we are today. We've had to move beyond that simple story of just chemical imbalances and into a much more complex, much more nuanced, and honestly, a much more humble understanding of what depression is and how we can treat it. So, what's the big takeaway from all this? Well, that chemical imbalance theory, it's not necessarily wrong, it's just at best an incomplete picture. The honest truth is, we still don't know for sure what causes depression, or even exactly why these drugs work the way they do. But the really good news is that this long, winding journey has given us tools that are genuinely effective. We know these medications can and do help, and we know that for many, they work best when you combine them with therapy. We've come such a long way since those accidental discoveries back in the 50s, but it's clear we still have a long way to go. Which kind of leaves you wondering, doesn't it? What will the next accident, the next totally unexpected discovery, reveal to us about the incredible, amazing complexity of the human brain? Thanks for digging into this with me.